When developing an effective compliance program for an organization, which one of the following obstacles presents the largest threat to its long-term success? A. Employees fear retaliation for reporting violations. B. There is a lack of buy-in from leadership. C. No established lines of communication exist for disseminating information throughout the organization. At which level of the Medicare Part A or Part B appeals process is the appeal decision by the Office of Medicare Hearings and Appeals, OMHA? A. First level of appeal. B. Second level of appeal. C. Third level of appeal. Which of the following is an absolute necessity to have a successful compliance program? A. Continuous training and improvements. B. Effective reporting path. C. Non-retaliation for whistleblowers. D. Reliable and equal discipline. A compliance program with well-written policies and procedures. A. Can be successful if consistently reviewed and maintained. B. Cannot be effective due to the sheer volume presented. C. Will be effective if read by management. D. Will not be successful without the proper oversight. A compliance officer can achieve a higher level of compliance and ethics engagement by A. Ensuring leadership reads the policies. B. Increasing management involvement. C. Responding to compliance hotline calls. D. Monitoring the code of conduct. Which of the following requires providers to be permanently excluded from all federal healthcare programs if found guilty of healthcare-related fraud a third time? A. Deficit Reduction Act of 2005. B. False Claims Act. C. Balanced Budget Act of 1997. Which statement is true regarding compliance programs? A. Compliance programs are considered more dangerous if they are developed but not implemented. B. Compliance programs can detect but not prevent criminal conduct. C. Compliance programs are only required by law for healthcare entities that have more than $500,000 in annual revenue. Formal statement outlining a plan for a specified subject area. It usually cites state and/or federal required actions or standards. A. CAP. B. Procedure document. C. Policy document. What is the term called for an organization's commitment to compliance by the board, management, and employees? It summarizes ethical behavior and legal principles of the healthcare organization. A. Code of Conduct. B. Federal Sentencing Guidelines. C. Internal Controls. The U.S. Federal Sentencing Commission was organized in, published its initial set of guidelines in, and included Chapter 8 of the Federal Sentencing Guidelines for Organizations, FSGO, in A. 1980, 1987, 1999. B. 1985, 1987, 1991. What is the best definition of Medicare/Medicaid fraud? A. Attempting a scheme against the Medicare-Medicaid program. B. Knowingly executing a scheme against the Medicare-Medicaid program. C. All of the above. What is the best definition of Medicare-Medicaid abuse? A. Knowingly defrauding the Medicare-Medicaid program. B. Intentionally violating Medicare-Medicaid guidelines. C. Unknowingly violating Medicare-Medicaid guidelines. D. None of the above. A provider intentionally upcodes services to a higher level to receive a larger reimbursement from Medicare-Medicaid. Is this violation fraud, abuse, or neither? A. Fraud. B. Abuse. C. Neither. What is true about Medicaid integrity programs? A. Established by the DRA of 2005. B. Federally administered and state monitored. C. Audited by MACs. D. Created to combat Medicare provider FWA. Reporting systems should be A. Marketed to contractors. B. Outsourced to a vendor. C. Operated by management. D. Publicized to all employees. Regarding patient credit balances, which of the following are good practices for addressing credit balance compliance risks? A. Review reporting capability, as most EHRs can detect a credit balance issue. B. All of the above. An employee reports a potential problem with the attending physician's presence for surgery. Which of the following is the compliance professional's best action? A. Investigate the issue. B. Approach the surgeon. C. Notify the OIG. The entity's level of commitment to compliance is directly related to the resources, human and financial. A. True. B. False. The code of conduct should address the organization's A. Culture. B. Beliefs. C. Ethical position. D. All of the above. When developing an effective code of conduct, an organization should consider A. Soliciting another organization's code and tweaking it to fit. B. Methods for reporting issues. C. Zero tolerance for fraud and abuse. D, B, and C. Sue works for ABC Family Physicians. The providers at this office ask her to research the department that helps protect patients from unfair treatment or discrimination. What department or agency would that be? A. Equality in Employment Agency. B. Office for Civil Rights. C. Department of Justice. Which government department is comprised of thousands of employees who enforce the nation's federal criminal laws and help develop and implement criminal law policies? A. Department of Justice. B. Centers for Medicare and Medicaid Services. C. Healthcare Lawyers Association. Which department is the largest Inspector General's office in the federal government? A. HHS Office of Inspector General. B. Office of Civil Rights. C. Department of Justice. D. Centers for Medicare and Medicaid Services. What term would be used for actions that, either directly or indirectly, result in unnecessary costs to the Medicare program? A. Abuse. B. Mistake. C. Waste. You are the new compliance officer for a hospital and see that it is currently under an OIG-CIA. What would be the first course of action in your new position? A. Review the current OIG work plan and update the audit schedule for the hospital. B. Review the code of conduct and policies and procedures and update them as appropriate. A compliance professional is conducting a policy review. Which of the following procedures must be included in the policy for statistically valid sampling and extrapolation? A. Financial error rate exceeds 5% with a refund to occur within 60 days. B. Financial error rate exceeds 5% with a refund to occur within 90 days. Regarding statistical sampling, what is an example of a failed effort to use statistical analysis? A. Users who did not understand the subject matter or application of sampling. B. A well-rounded data sample. C. Knowledgeable staff who are involved in the process. A hospital with an imposed CIA performs a discovery sample as part of the claim review and finds it has a financial error rate above 5%. OIG requires that the hospital then conduct a full sample. A. True. B. False. If an IRO identifies any underpayments during a CIA claim review for a hospital, these may be netted, or offset, from overpayments. The hospital may also consult with the appropriate payer to ensure that the underpayment amounts can be used against outstanding overpayments. A. True. B. False. What is RAT Stats? A. Government hotline for fraud and abuse. B. Government statistical rules, for example sample size. C. Hospital technology for tracking sampling. D. Statistical software for hospitals to use. The largest and oldest accrediting body for healthcare organizations in the United States, which has accredited more than 22,000 organizations is A. World Health Organization. B. American Medical Association. C. The Joint Commission. One of the most important foundations of your compliance program is A. The Compliance Policy Manual. B. The organization's Code of Conduct. C. The Non-Retaliation Policy. D. Adequate staffing and information systems. A number of standard components are usually included in codes of conduct. The most common components are the following except A. Non-retaliation promise. B. Auditing status. C. Organization's values. Which is not one of the 7 fundamental elements of an effective compliance program? A. Implementing written policies, procedures, and standards of conduct. B. Conducting effective training and education. C. Developing policy guidance summaries. When creating and implementing a compliance plan, the compliance officer should have A. No approval. B. Board approval and resolution. C. Patient approval. D. Legal approval. What can providers review that will help them understand the compliance requirements of a clinical lab? A. Laboratory Provider Handbook. B. OIG's Clinical Lab Guidance. C. OIG Developing an Effective Compliance Program. D. Physician Desk Reference. Any laboratory performing testing on specimens derived from a human being for purposes of providing diagnosis, prevention, treatment, or assessment of health, regardless of whether they participate in Medicare, must A. Participate in a quality assurance program. B. Enroll in the CLIA program. C. Have a certificate of compliance. If I'm only doing blood draws, do I need a CLIA number? A. No, a CLIA number is not required if the facility only collects specimens and performs no testing. B. No, a CLIA number is not required if the facility only collects specimens and performs minor testing. Which certificate is issued to a laboratory that enables the entity to conduct moderate to high complexity laboratory testing until the entity is determined by survey to comply with the CLIA regulations? A. Certificate of Compliance. B. Certificate for Provider-Performed Microscopy Procedures. C. Certificate of Registration. Related to legal doctrines for protection from disclosure to protect certain documents during discovery. What is the work product doctrine? A. Ensures that attorney documentation is accessible to the hospital. B. Protects attorney documents that were prepared for litigation purposes. When should counsel be involved during an internal investigation? A. If the corporation may have to disclose inappropriate conduct and take remedial action. B. If there is an inadvertent billing error. C. If there is a question about the training program. Which of the following agencies indicate a self-evaluation after the discovery of potentially fraudulent acts? A. CMS. B. OIG. C. OCR. D. OSHA. Healthcare Financing Administration, HCFA, encouraged one of the following to promote consistency in interpretation of claims? A. Statistical sampling. B. Reporting. C. Discipline. What is the benefit of a contemporaneous review? A. Can provide a chance to do a self-disclosure of prior billing errors. B. Helps with creating a code of ethics. C. Can correct a problem before it grows to become a serious issue. How does Medicaid work? A. State administered. B. Federally administered. C. State monitored. What can a provider do if they are unhappy with an informal review by the state Medicaid program SUR unit? A. Dispute the informal review with the SUR. B. Request an administrative hearing. C. Request that the informal review be made into more understandable education. Which of the following laws applies to physician referrals? A. Stark Law. B. EMTLA. C. HIPAA. D. False Claim Act.